name's Megan. I'll be your nurse today. So what are you in for today?
I have this lump on my wrist.
Do you have any history of that before? Have you had it anywhere else?
No, I've never had it before.
Does anybody in your family have?
Not that I'm aware of.
Have you had any past surgeries, injuries, or operations?
Years ago, I had tubal ligation and I had a cyst removed on my foot.
Okay. Do you have any allergies?
Just Celebrex. I had a reaction to.
Okay. And are you on any medications?
I'm on several.
Do you know what they are?
Norvasc. I'm on a cholesterol med. I don't have them in front of me right now.
Looking
Pressure.
Hyalin. When did that lump start?
I've had it for about a year or so.
What is it always there? Like, what makes it better or what makes it worse?
It doesn't really hurt. Sometimes I feel when I move my wrist in this motion, it sometimes feels like it sort of pulls.
Okay. Does it describe how it feels? Do you feel?
I don't feel it. It's just
So
when I put my hand over it, it's hard.
you wouldn't say it radiates to any
No.
other regions, and there's no pain. It would be a
No.
0 on a pain scale.
Yeah, there's no pain.
Okay. What do you think it is?
Someone told me it could have been a ganglion cyst.
Okay. All right. We're gonna get started on your height and weight. So if you could stand up for me, please. And I'm just going to take your height, turn around. Okay. And turn around and take your weight.
Turn around.
Okay. Before I start anything, I'm going to wash my hands with soap and water. Typically, you can sing in your head like happy birthday to make sure that you're washing your hands long enough. And you want to scrub hard enough, even under your fingernails, to get the dirt and bacteria out. So maybe should we set? Okay, so I'm going to take your temperature and I'm going to take it under your tongue because there's a lot of rich arteries underneath there, so it'll be able to determine your internal body temperature. Your tongue. Normal range is 96.4 to about 99.1. Let me take that. And yours is 98.6, which is the normal average. Anything higher could indicate a fever, which would be your body's reaction of releasing purgens to fight an infection. I'm going to take your pulse for 30 seconds, so you're going to have your arm. I'm going to take your radial pulse for 30 seconds. Okay, so the rate was normal. It was between 60 to 100. It was 84 beats per minute. Over 100 could indicate like after exercise or if your heart's just working really hard. Anything lower could just indicate you're just resting, lying around, or if you're on certain medications. The rhythm was regular. There was no palpitations noticed, which would mean like there would be a beat and then 2 beat, and it was just normal like this. And the force, I would rate it a 2+, which is normal. Sometimes you can feel it stronger than others. A lower force indicated would be if you had bad circulation. And the elasticity of your veins were elastic. I could press them down and they would pop back up, and if they were hardened, that could indicate like early heart failure, like atherosclerosis, which is like hardening of your arteries. So while I was taking your pulse, I was also assessing your respirations, and they were normal. You had about 13 respirations per minute. Normal is anywhere in between 10 to 20. 20 is over 20 is you're struggling to get air. It could indicate like a pneumothorax, or you have a collapsed lung where you're trying to struggle to get a breath. And noted that your patient positioning, you're not struggling for air. Sometimes like patients will lean over on the table to try and catch breath, which could indicate like they're having an asthma attack or COPD. And their chest was symmetrically expanding, which was also normal. Sometimes only one side of the chest will go up in a case of like a pneumothorax, but you had symmetrical expansion while breathing. Take your blood pressure now. I'm going to use an adult size cuff. I could use your other arm. There's different size cuffs. There's a newborn cuff, and then there's bigger cuffs for people that are either extremely obese or if they work out a lot and have a bigger size arm. And you just determine by looking at the arm. And I'm placing this above the brachial artery. And you can rest your arm on the table, legs uncrossed. I'm going to use the diaphragm of my stethoscope and put it right over your brachial artery.
It's cold.
And now I'm just going to take your pulse again. And I'm going to inflate the cuff until I cannot feel your pulse anymore. Your blood pressure was normal, it was 120 over 80, which is actually the gold standard blood pressure. And that's good because you had said you were on some hypertensive medications. Anything higher could indicate hypertension. That would be like 140 over 90. And that could just indicate like a bad diet or smoking. And not exercising could elevate your blood pressure, and anything lower just could be like you're not getting enough salt or you're not hydrated. But yours was within normal limits, 120 over 80.
That is good for me because you